A warning tonight about a deadly fungus spreading at an alarming rate throughout U.S. healthcare facilities. The CDC says it's resistant to drugs.
10 TV's Lindsay Mills is here. She spoke with an infectious disease expert today for what we need to know. Lindsay?
Yolanda and Andrew, we're talking about a fungus called Candida auris, and there are two important bullet points here. One, it's resistant to a lot of drugs used to treat infections, and two, it's spread in healthcare settings and nursing homes.
Here in Ohio, according to ODH, the first clinical case of Candida auris was identified in 2020. Fast forward 2 years, there were 79 cases in 2021. That's according to the CDC, tracking cases nationwide. The Ohio Department of Health also tracks where it's been found in the state, but the data has not been updated since November. Columbus Public Health confirms it is aware of one case from late February of this year. Dr. Amesh Adalja is an infectious disease specialist at Johns Hopkins. He says this fungus spreads in hospital and nursing home settings.
What's the level of concern, would you say?
When you think about from an infectious disease policy standpoint, the concern is very high because this is a fungus that's emerging, that's hard to treat, that's preying on people that are very debilitated. But when you think about it in terms of the risk to the general public, does it pose the same risk, for example, as influenza or COVID-19? No, it doesn't. But it is something that's really important that we get a handle on.
Screenings are underway to prevent outbreaks in high-risk settings.
So this is something that can be done to identify it quickly in a facility and then take action to try and prevent it from causing true infections in people.
And you can find my full interview with Dr. Adalja at 10tv.com. In the studio, Lindsay Mills, 10 TV News. Yolanda?